Good morning, everyone. I can see we've got lots of participants on today's meeting, and welcome to all of you to the new trainee welcome day for histopathology at the Royal College of Pathologists. If any of you happens to not be a new trainee in histopathology, this would be a good time to leave. But hopefully you're all in the right place and will enjoy this morning's meeting. I should begin by introducing myself, and then we'll introduce some of the other people on today's panel. So my name is Ronan McMullan. I am the Clinical Director for Training and Assessment here at the Royal College of Pathologists, and I'm a microbiologist by background. Today's seminar is really to give you all an overview of how the college will support your training during the next 5 or so years. So we have lots of college staff on the panel today, and we have lots of speakers from lots of colleagues who will be involved with your training and will be able to give you a really good feel for what will happen during your training. So I thought that I'd begin with a couple of housekeeping points. And the first housekeeping point is that today's meeting is being recorded. And so, I'm sorry, I hadn't had my camera on for a moment or two there. So today's meeting is being recorded and will be available on the college website in about a week or so. But I'd like you all to be reassured that your names won't be visible on that recording, so it won't be seen whenever it's played back on the website. We'd like you to ask questions today. Feel free to ask the speaker some questions, and you can do that by looking in the bottom panel there of the webinar. You can see a Q&A function. So if you type in some questions there, we'll answer them either on that Q&A function during the meeting or afterwards. And any questions we don't get to, we will provide written answers to, and they'll be on the website with the webinar recording. So you can see some people on the meeting with me, and I'll just give these guys a chance to introduce themselves. These are the people who you will interact with most at the college during your training. These are the people who know all of the answers to all of the questions you'll have, and that's the training and assessment team. So I'm just going to go through each of the people you can see and invite them to introduce themselves. So shall we start with Jenny?
Hi everybody, I'm Jenny McGinley and I'm the training manager at the college. One of my team's main responsibilities is the registration and monitoring of trainees, and therefore we'll be here to answer any questions or queries you have throughout your training. Thank you.
And Louis.
Good morning, everyone. I'm Louis Nyerere and I'm the training coordinator at the college. I work in the training department, and yeah, I look forward to be assisting you in a variety of ways. Thank you.
And Adibia.
Hi everyone, I'm Adibia Kufo and I'm the training coordinator of the college.
Great, so you've just heard from the training team, and along with the training team we've got the assessment team today. So Sandra, would you like to introduce yourself?
Hi everyone, I'm Sandra Jura. I'm the assessment manager at the college, and I guess most of the contact that I may have with you is regarding the LET e-portfolio.
And Michael.
Hi everyone, my name is Michael Gillett. I'm the assessment administrator at the college, and one of my main responsibilities is also dealing with queries on the LET e-portfolio system, and I'll be giving you a little demonstration of the system later on today.
Okay, so as you've heard, Michael will be speaking later on, but the other colleagues here you'll not hear presentations from, so I thought it would be a good chance to let them introduce themselves so that you can put faces to the names and know who you're chatting to in due course. So I hope that you really enjoy today's session and find it useful. We have lots of speakers, as I say, and it's a star-studded lineup, and we're going to start with Professor Mike Osborn, who is the president of the Royal College, and he's going to give us a pre-recorded talk because unfortunately he was unable to join us today, and so I'm going to allow him to take over the floor now.
Hello, my name is Professor Mike Osborn and I'm president of the Royal College of Pathologists. I'd like to welcome you today to the new Trainee Day. Pathology is hugely important. 95% of every single healthcare interaction in the United Kingdom is underpinned by a pathology test, ranging from blood tests to histology to a multitude of other tests which pathology offers. We are 17 specialties in pathology, and we welcome everybody from everywhere who is part of the pathology family to be represented by the college, and I would welcome you today. Our 17 subspecialties cover a diverse range of interests and areas of healthcare. Some of them are very directly patient contact related. For example, we have specialties like hematology, microbiology, and infection, where people may be involved in face-to-face clinics with patients and directly see them on a day-to-day patient care basis. Others of our specialties are far less directly patient-facing. So, for example, some may be very laboratory-based, where people rarely see patients in a face-to-face situation. For example, histopathology. However, all our specialties are vital to patient care. You could not have healthcare without pathology, so we are a fantastic specialty within medicine as a whole. What this means is that there are a whole range of specialties within pathology, and there's something to suit everybody. Because of the wide range of specialties we cover, there is something for everyone, and even within each specialty, there are a huge range of opportunities within pathology. Those opportunities range from healthcare on a patient-to-patient and case-to-case basis to other things like research and teaching. For example, research is an area where pathologists are always in demand, whatever specialty of pathology they belong to. Virtually no research can be undertaken without pathology input because it is so key to patient care and to interpreting the data and to interpreting the way that the research is designed and structured and run. So if you'd like to pursue an academic career, there will be opportunities for you. But similarly, if you are working as a pathologist doing diagnostic work, there are a whole range of research opportunities that will be open from a project-to-project basis for you. Similarly, in teaching, because pathology underpins all of healthcare, there are opportunities in a wide range of teaching, from teaching medical students to medical postgraduates of all medical specialties, but also to teaching allied healthcare professionals as well, be they nurses, mortuary staff, or people more loosely affiliated with healthcare who need to have interactions and teaching. I personally have been involved in teaching all of these groups and including teaching the police and the military. So if teaching and training are areas of specific interest to you, then there are a large number of opportunities in pathology, whichever specialty you pursue. The result of this range of specialties and the range of opportunities is that you can develop a career that really suits you and which allows you to do the things that you are interested in. In addition, because pathology is so wide-ranging, there are lots of job opportunities in pathology. Job opportunities virtually anywhere within the United Kingdom or indeed around the world. And that means people can work where it's most convenient for them. Pathology is also very family-friendly. This means that it fits well with your work-life balance and gives opportunities for people to pursue their interests outside of work, which leads to a much better work-life balance. Pathology is very flexible, and this is becoming more so due to technology developments. This means people are more able to work from home and more able to work flexibly, which again improves work-life balance. In terms of the Royal College of Pathologists, we were formed 60 years ago, and we are here to support all our pathology specialties. This means that whatever specialty you are in, the college is there to support you, to help you, and to advocate for you, so that you have the support and resources that you need to be able to provide the healthcare that you wish to for your patients. For trainees of the college, there are many things, and we have a very active trainee committee who feed into many of the activities of the college, giving us a trainee perspective, making sure that colleagues never lose sight of the role of trainees and the importance of trainees as the next generation of consultants. We have a website that offers a whole range of resources specifically for trainees, and we also have a pathology portal, which is a superb online vehicle for learning for trainees and for others. In addition to this, we run webinars, teaching sessions and other events. So there are a whole range of things that the college offers specifically for training and trainees. But beyond that, the college is there to support the profession, particularly in terms of raising the profile of the profession nationally and internationally, and ensuring that the profession has the resources it needs to be able to provide the service it needs and wants to provide to its patients, particularly around things like workforce. Pathology is a fantastic career. It offers a whole range of opportunities, and there is something for everyone. We welcome everybody at the Royal College of Pathologists who is a pathologist and who works in pathology, and we are keen to support anyone who is interested in a job in pathology, and our trainees are a valuable resource to us in the college. We will work hard with you and to support you and to help you develop a career in pathology. I would like to welcome you today to the Trainee Day, and I look forward to meeting you in the future. Thank you.
Okay, so that was Professor Mike Osborn, the Royal College President, with his introduction to the college. So our next speaker today is Joe Brinklow, who is the Director of Learning at the college. Joe has been at the Royal College of Pathologists for a very long time, and there's nothing that she doesn't know about training. Joe looks after all of the training and assessment and exams functions at the college, and so she's going to give you an overview of the role of the college during your training.
Hi everyone, it's nice to meet you today, albeit virtually. My name is Jo Brinklow and I'm Director of Learning at the Royal College of Pathologists. I have oversight of all of the college's training, examinations and assessment activities, as well as the international activities of the college. So, welcome to the college. We are quite unique as a medical Royal College. We have a number of different professions that are members. We have doctors, clinical scientists, dentists, and veterinary pathologists too. And we oversee a large number of pathology specialties, at least 17. And even within that, there are different subspecialties and areas of practice too. Just going to talk a little bit about what the college does, and this part of this section is talking about the main things that you might hear from us about, or we might hear from you about in the next 5 years or so as you go through your training programme. The college has lots of different committees, but the ones that are most relevant to you as histopathologists or in the different cellular pathology specialties is the SAC, but primarily the College Specialty Training Committee, which is also known as the CSTC, and has oversight of training for the cellular pathology specialties. More recently, they've developed curricula and workplace-based assessments, and the curricula were published in 2021. And you will find all of the new workplace-based assessments that complement the new curricula in the e-portfolio, which is known as the LEP system. And if you've registered with the college already and been given access to the LEP system, you might have had a chance to have a brief look at it. But that would be really important for you to keep up to date as you're going through your training and making sure that you're adding all of your evidence about your progression. That's where the ARCP guidance comes in. So the ARCP guidance just gives you an overview of everything that you should be gathering during the year as you move towards your ARCP. These are normally held and arranged by the deaneries in the spring, sort of end of April, May, June time. So keep an eye on that during the year and make sure you're keeping everything up to date. You also have access to the learning platform, which is the Pathology portal. This was developed in conjunction with what was Health Education England, now NHS England. That's got a whole range of learning material on there that you can use to support your training. You may need to contact the college during your training for advice and guidance. Please do not hesitate to do that. We may not always be the right people to ask or the people that can help you, but we will always be able to put you in contact with the people that can. But more often than not, we will be able to provide you with advice and guidance and help you sort anything out that needs to be done. It may seem a long way off now, but when you come to the end of your training, the college will also recommend you for the award of the CCT, the Certificate of Completion of Training, which gives you access to the GMC Specialist Register. Separate to all of that, there is also a College Trainee Advisory Committee, and I know you'll be hearing from Rachel separately about that, but the TAC has representation for trainees in all of our different specialties, and they're very active. So again, you may be well hearing from your TAC rep as you go through training. The college, although it's based in London, is a UK college, and we have regional councils for Wales, Scotland and Northern Ireland, and we also have regional representatives for England who run regular surgeries where members can go along and ask questions and have discussions about things that are important to them and that they want to draw to the attention of the college, and you're also very welcome to do that. And we also work very closely with deaneries. And just on from an international perspective, the college does support international medical graduates to obtain GMC registration through a couple of different schemes that we run. So if you have come into contact with us through that route, again, very, very welcome. It's nice to have everybody here today. Now, you may wonder why I'm talking about a totem pro card. That doesn't really fit in with the theme of my talk. There's two things. So one is this page is taken from the college website. This is where you'll need to register as a trainee, and if you haven't done that already, I would really encourage you to do that, because that is what will give you access to everything that you need as a trainee. So that's how you'll get access onto the LEP system, and so on and so forth. One of the benefits of registering as a trainee with the college is that you can get access to this Totem Pro card, which you might be familiar with if you were in university in the UK. And it's a card that you can buy for a very small amount, but gives you access to a range of different discounts from a range of different retailers, and it's very popular with our registered trainees. So if you would like one, please go onto the website and start the process to buy one, and the training team will be able to help you get access to that. So what else does the college do? So in addition to some of the things that I've briefly gone through with you that are more relevant to what the college does for you in the next 5 years or so, the college undertakes a range of different activities to support and promote pathology. You may already know, because you may have taken part already in some of the things that we do to promote pathology to undergraduate and foundation doctors. That includes running summer schools, essay competitions, webinar events to promote the different careers within pathology, and so on and so forth. Some of the other work, and something that takes up quite a lot of resource in the college, is undertaking workforce surveys, and that's where we gather evidence about the workforce, how many people are joining, how many people are leaving, and looking at vacancy rates and things like that, and then using that evidence to lobby government to advocate for pathology services across the UK. As you go on through your career, there'll be other things that will become available to you, the CPD portfolio, for example, and there is a whole range of guidelines and data sets on the college website which you can access now, and which you can use during your training to support that. You'll also get access to the college's quarterly bulletin for members. And as you can see, there are a whole range of other things there as well, which you can take advantage of. This is just a brief bit of information about the pathology portal. So as I say, this is where you can access the pathology portal from the college website. It's also available from the hub as well. But please do take a look at that. There's lots of histopathology content on there. This is the part of the website where you can really access all of the information that you need over the next 5 years or so. You can't quite see it's dropped up at the bottom, but you'll be able to find your curriculum, your syllabus, the ARCP guidance that I mentioned. You'll be able to access the LEP system from here, and all of the information that you'll need about your examinations as you start to go through your training and start to think about preparing for your Part 1 and then your Part 2 exam. So as a college, we work with a range of other different organisations together to support you during your training. We have a lot of contact with postgraduate deaneries through the training programme directors and the individuals that work there as well. And we are regulated by the General Medical Council. So these are just some key documents. You might want to read them, you don't need to necessarily, but just so that you're aware of some of the standards that are in place and how these are implemented. So the first two documents, Excellence by Design and Generic Professional Capabilities Framework, these are applicable to us as a college. We use Excellence by Design when we're developing curricular assessments and examinations. They set out the standards that we have to meet when we're developing those, and everything that we do in that regard has to be approved by the GMC before we're able to publish any new curricula or make you aware of any changes to the examinations and so forth. Promoting excellence is around the management and delivery of undergraduate and postgraduate medical education and training. And so that sets out the standards for all of that, and really around how training is implemented and delivered across the UK. So something else that you might be aware of is the National Training Survey. This is an annual survey that the GMC undertakes both for doctors in training and trainers. And they use that survey to be able to review how training is progressing, looking at all different aspects of it, well-being, work, all sorts of things. The results can be looked at in terms of specialty, in terms of deanery, in terms of training programme. So it's really important that everyone responds to that survey when it comes out each year. In terms of the role of the deaneries, there are 4 statutory education bodies, which is NHS England, NHS Education for Scotland, or NES, the Wales Deanery, and Northern Ireland Medical and Dental Agency, NIMTA. And underneath those sit the deaneries. The deaneries have responsibility for specialty programme management, quality management process, individual trainee progression, trainee careers advice and support, special needs and remediation, as well as trainee revalidation. There is quite a lot that the college does and the deaneries do that overlap. So for example, it will be the deaneries that will give you your date for your ARCP, but it's the college that provides the e-portfolio where you collect and submit all of your evidence. But we do work very closely together and keep each other up to date with what we're doing. So finally, there are a range of different members of staff at the college who can help you as you're going through training. I just thought it'd be helpful to give you some email addresses so you know who to contact, and we can make sure that we can help you with any of your queries. So if you have any questions at all about registering with the college, your curriculum, syllabus, ARCP guidance, CCT, training advice, and so on and so forth, then you can email training@rcpath.org. For the LEP system, it's assessment@rcpath.org. For the pathology portal, very straightforward, pathology portal@rcpath.org. And then as you're coming towards your exams, it will be exams@rcpath.org. But again, all of the information that you need is on the website. Please use that as your first port of call. And I'd like to wish you all the very best of luck with your training. Thank you very much.
Thank you very much, Jo, for an excellent overview. So our next speaker this morning is Dr. Ed Cheesman, who is the chair of the Histopathology or Cellular Pathology College Specialty Training Committee, and he's going to tell you about the histopathology curriculum and other aspects related to that for your training.
There we go. Hopefully you can see my screen there. My name is Ed Cheesman. I am a consultant pediatric pathologist. I'm based in Manchester at Royal Manchester Children's Hospital. I'm the chair for the College Specialty Training Committee, which Joe has already told you a little bit about. The committee consists of TPDs from across the country, representatives from exam committee and so on, and really oversee the delivery of your training and help out with if deaneries are having any issues or questions, and there's oversight of the curriculum and the assessment. So I'm just going to give you a brief overview of the curriculum. For those of you who've already had a look, you'll know that the curriculum is a rather hefty document. So we don't have time to go into a great amount of detail, but hopefully an overview will just give you a few tips to get a hang of the curriculum. So the objectives really for me today are just to introduce the structure of histopathology training and mention the histopathology specialties. I'm going to explain what is expected of you in the first 2.5 years of training. That is the integrated cellular pathology training period. I'll briefly introduce the curriculum and the syllabus documents and show you a few examples from there. I'll highlight the ways in which your learning can take place. I'll briefly introduce the assessments that you will be expected to take part in during your first years of training. And then I'll just highlight some important choices and decisions that you need to start thinking about, even though you're only sort of a few weeks into training. So just to start with the curriculum overview, this is I think Joe has showed you, if you go onto the RCPath website and go onto the training tab, you will come across this page where the training is broken down for each of the specialties within pathology. And probably what you're going to be interested in at this stage is the Histopathology 2021 curriculum. And at some point you may want to just have a think or a look at some of the other specialty curricula within cellular pathology. That's the diagnostic neuropathology, forensic histopathology, and pediatric and perinatal pathology curricula. But for the most part, we're going to concentrate on the Histopathology 2021 curriculum. I've pinched this slide from my predecessor, Dr. Claire Evans. I'm sure she won't mind, but this is just really to give you a breakdown of the structure of training within cellular pathology. So on the left here, you can see, and this is where you will find yourselves at the moment, is at the sort of the beginning of this period within the integrated cellular pathology training. And this is a common period of training for all of the cellular pathology specialties. And that lasts for 2.5 years for most people. Now, at the end of those 2.5 years, this is really where your first decision comes, and we'll look at this a bit later. You can either continue with run-through training, higher specialist training in histopathology, with the option of some additional modules in autopsy and cervical cytology. And that's really a 5-year program if you were to do all of that. And if you're going to take the additional modules, then that will add an additional 3 months for each module. If you decide to go into one of the other specialties, forensics, pediatric and perinatal, or diagnostic neuropathology, there is a competitive interview towards the end of the ICPT. And if you are successful in that interview, then you will proceed into specialty training. You'll get a new national training number. And For forensics and pediatric and perinatal pathology, the training is 3 years, and for neuropathology, it's 3 to 3.5 years. And we'll just look at that again towards the end of the talk. So you'll be wondering what is expected of you during this first period of training, the ICPT. And you've probably already started doing this. The most fundamental thing is that you will be looking at normal histology and understanding what is normal. And that really is what you need to do before you can appreciate what is abnormal. This can sometimes be quite challenging because of course we are working in histopathology departments. So most of our specimens and biopsies tend to be abnormal. So sometimes it can be quite tricky to find normal histology, but there is always some around, and you will also need to go into the textbooks and perhaps some online learning to have a good look at what is normal before you can appreciate what is abnormal. You'll be expected to learn about the safety and function of the laboratory and the dissection room, and hopefully by now or otherwise soon, you will learn how to assess, describe, dissect, and sample various pathology specimens that come into the laboratory where you're working. Within the mortuary, you'll be learning about safety and functioning of the mortuary and the post-mortem room. Eventually, after some observation, hopefully you'll be eviscerating under supervision, and eventually undertaking an autopsy under supervision. And I suppose ultimately what you want to do is learn how to apply your knowledge from previous training within medical school and more recent knowledge within your histopathology training in order to write a histopathology report. That's, I guess, the crux of what we do as histopathologists. So both histopathology reports and post-mortem reports. And then most important skill probably of a histopathologist is interpreting the findings from histology or from an autopsy and coming up with a clinico-pathological correlation. And that's really something that you will be practicing and becoming or perfecting over the years of your training. Also during this time, you should gain some experience in the other specialties, pediatrics and perinatal, diagnostic neuropathology, and forensic pathology. And how you gain this experience will probably vary depending on local arrangements within your deanery. But ideally, you should gain experience in all of those. And if you do have a particular interest in any one of those, or you want to explore them a bit further, then do speak with your training program director and see what can be arranged locally. And finally, as Joe's already alluded to, in terms of assessment and portfolio, you will be expected to complete your work-based assessments, multi-source feedback, and ultimately pass the Part 1 exam. So if we move to the curriculum document, the curriculum really is based around the capabilities in practice, or the SIPs, shall we call them, which describe the work and tasks that you'll come across within histopathology. There are 11 SIPs. 7 of these are generic SIPs, and they're the same across all of the medical specialties, and you have probably come across these already. And then the remaining 4 SIPs are specific to histopathology. So just having a look at the 7 generic SIPs. So these might be generic, but of course they will have a particular application to cellular pathology. So the first is very, very broad, and it's being able to function effectively within the healthcare and other organizational management systems to deliver consistent, high quality patient care. So that's a very broad subject that we have to cover, and you've already been doing that during your training within medicine. The second is to be able to work within ethical and legal frameworks across all aspects of your clinical practice. And of course, within histopathology, this can be quite varied. So this might include working with coroners, working with police, working with the HTA, and these are all frameworks that you will become familiar with as you go through your training. Thirdly, you need to be able to communicate effectively and take part in shared decision making. And this is, I think, such an important element, particularly within cellular pathology. As you become more senior, you'll certainly once you're a consultant, you will find that you are working with the same people every day within a small, medium, perhaps a slightly larger department, and communicating well with colleagues, whether they are consultant colleagues, biomedical scientists, secretaries, trainees, is really, really important. And this is something that you'll have to work on throughout your career to maintain good relationships with colleagues. Number 4 is to maintain patient safety. Of course, patient safety is always at the forefront of what we do. Number 5 is being able to contribute to research. Some of you might decide that you want to do a significant amount of research, but even for those who maintain more of a clinical career, there will always be opportunities to either do your own research or to support clinical colleagues who are undertaking research. Is I guess one of the reasons that we enjoy histopathology. Number 6 is referring to our role as educators. And even at this stage in your pathology career, I think you'll be aware of the importance of people taking part in education, delivering teaching and training. And very soon you will be expected to do the same, to be helping in the education of perhaps undergraduates, biomedical scientists, and eventually your more junior colleagues within histopathology. Number 7 is really important, and again, something that will follow you throughout your career, and that's the ability to self-appraise, learn and adapt. And of course, we're all continuously learning. I don't think anybody knows absolutely everything there is to know about pathology. So that is a sort of a lifelong role that we have to take on. We then move on to the histopathology specific SIPs. And I guess this really forms the crux of what you are here to do. So the first one of these is able to demonstrate leadership and management within the laboratory setting. And I think that's really important to remember. We are working within a laboratory specialty. We are not, we're not stuck in our office behind a microscope all day. There is a laboratory behind absolutely everything that we do, and we need to take an active role in the running and management of that. The next one is that we should be able to use the laboratory and other services that are available to us to do the appropriate investigations, make the appropriate diagnosis, and of course, leading on to the appropriate management of our patients. We need to be able to contribute to the multidisciplinary team. And again, here, I think it's important to remember we're not here just to simply issue reports and then move on to the next case. It's really a requirement of a pathologist to participate within the overall management of our patients, and the MDT really is the place to do that. And finally, and this is probably the most important and all-encompassing one of these SIPs, is that we are able to take, manage, and interpret pathological specimens accurately and safely. And this really is what we do as histopathologists. So I've just taken one SIP to use as an example. So all of the 11 SIPs are further broken down into these descriptors. Now, the descriptors will give you a little bit more detail in what is expected of you in terms of your training. So, for example, I've taken SIP number 9, which is the appropriate use of the laboratory to deliver safe investigation and diagnosis. So there are several descriptors for each SIP. I won't read these all out, but essentially they will just go into a little bit more detail so that when you meet with your educational supervisor or your TPD, it's quite clear to you what is expected of you. Each SIP is associated with a number of generic professional capabilities. Again, Joe mentioned these, and these are a framework which have been put together by the GMC. There are 9 domains within the generic professional capabilities, and you can just see them here on the left. So each SIP will have a number of these GPCs associated with it. And finally, just to help you in understanding how you can show that you have achieved the required competencies for each SIP, there is a box here which tells you what you can use to evidence that. So for most of these, you will be referring to your LEPT portfolio, where you will be collecting evidence in form of workplace-based assessments and MSFs. And of course, passing of the Part 1 and 2 exams goes some way to evidence your competency, as do the exams in autopsy and cervical cytology, if you choose to do those. To help you even further, within the curriculum, you will find these learning maps. And these are really to give you an indication of where you should be for your year of training. So you can see, again, we've used SIP number 9 as an example. And then across the top here, you have the 4 descriptors, which we saw on the previous slide. And for each of those descriptors, there is just a brief summary of what is expected of you for each year of your training. So the 1 to 12 here is month 1 to month 12 of your training, month 13 to 24, and so on. And this goes all the way through the 5 years of training. So you can see that during your ST1 year, you are expected to achieve these competencies, and you can use these learning maps as a guide. And how can your competency be assessed for all of these SIPs? So we use these entrustment levels, and again, this is something that you would have been using probably throughout your training so far. As you know, we always start off by observing a procedure. So for example, if we take conducting an autopsy, an example, at this stage, all that will be expected of you is to observe. No one is going to expect you to independently undertake an autopsy at this stage. So we start off at level 1, where the entrustment is for observation only. The next level, level 2, is where you are entrusted to undertake a procedure, but with direct supervision. As you become more competent, we move on to level 3, where you are entrusted to undertake, let's say, an autopsy, but with indirect supervision. So somebody is around and available in the background should you need them, but they are not there watching you undertake the procedure. Finally, and this is where we are aiming to be towards the end of your training, where you are at level 4 and you are entrusted to undertake a procedure completely unsupervised. Now, of course, some competencies or some duties you will be able to undertake at level 4 pretty early on in your training, and we'll look at that when we come to the discussing independent reporting. But for example, cutting up and reporting of an appendix, we hope that you will be able to do this unsupervised relatively early on in your training, whereas there are some more complex tasks which you wouldn't be expected to do unsupervised until you are perhaps at ST4 level of your training. This is just taken from the curriculum, and again, you can use this when it comes to your ARCP. This this appendix gives you an indication again of which entrustment level you should be at for your year of training. So along the top here, you can see these are essentially the ST levels, so ST1 through to ST5. So for each of the 11 SIPs and for each descriptor, you can see here which level of entrustment you should be at for your year of training. And you can, when you sit down with your educational supervisor during the year, you can sort of identify where you are at for the various descriptors. In addition to the curriculum document, there is a separate histopathology syllabus, which obviously is also available on the RCPath website just underneath the curriculum. And I just highlighted some of the phrases here in red, which is taken directly from the syllabus, but I think these are really important to note. The syllabus is an adjunct to the curriculum. It's there to help you work through the curriculum as you go through your training. It's not designed to be prescriptive or exhaustive, and it's merely a guide for yourself and for your educational supervisors and TPDs. But it is a helpful document. And the syllabus document has very much summarized here what is expected of you, and we've already touched on some of this. But essentially, what is expected of you in your training in cellular pathology is to gain a deeper understanding of medical pathology and the pathological basis of disease and anatomy, an understanding of the macroscopic and microscopic appearance of various diseased organs, the autopsy process, the importance of using clinical information and patient history in interpreting your findings, gaining an understanding of newer ways of working, and you'll come across digital pathology and certainly molecular pathology now within most departments. You'll be expected to very soon producing reports within your various IT systems wherever you're working. You'll be, as we said, expected to understand the functioning and organization of a laboratory. Of course, you'll be expected to have all of the generic skills of doctors that we've already discussed, and you'll be expected to have an understanding of the various specialties that come under cellular pathology. Again, very important to note that this is a competency-based curriculum, so there are no prescriptive numbers you are expected to achieve. However, the syllabus does highlight an indicative minimal practical experience that is a guide of where you should be at the end of each year. So within the first year of cellular pathology training, you should be seeing in the region of 500 cases of surgical pathology and 150 cases each of cervical and non-cervical cytology. And in year 2, that goes up slightly to 750 surgical cases and 200 each for cervical and non-cervical cytology. This is not prescriptive, and this really it is up to your educational supervisor, TPD, and local deanery what they accept within your ARCP as an acceptable number of cases. But this gives you an idea of what you should be aiming for. Also within the syllabus, there is some good advice on how you can attain all of the competencies and learn all of the knowledge that is expected of you. And the most important place that you will learn cellular pathology is through your routine work. And I think we can't emphasize this enough. The routine work is where you will learn how to be a confident and competent histopathologist. But as an adjunct, of course, you will be referring to textbooks, online resources, you'll be doing private study, you'll be participating in black box sessions and other teaching sessions within the department with colleagues. Of course, you'll be attending the regional training sessions. At some point, you might take part in other national training courses. Hopefully, as you progress through your training, you'll start attending conferences and other scientific meetings. Don't ever underestimate how much you can learn from your biomedical scientist colleagues. Some of them are extremely experienced and have been working in histopathology for a long time. So please do take advantage of what they can teach you. You'll learn a lot, particularly around the clinical scenarios from attending MDTs. As you develop special interests, you might decide that you want to do an attachment within a department that specializes in your area of interest. We've already heard about some e-learning opportunities even within the Royal College, but there are many other places you can do online learning. And then there are these various other areas where you can learn. But as I said, the most important place is within the workplace. There are, when you come to doing your exams, there are, of course, the part 1 and part 2 sort of exams, courses that prepare you for those exams. But we really just do want to emphasize that that really is not the way to pass the exam or to become a pathologist. That those courses are merely an aid and prepare you in the sitting of the exam. But in order to gain all of the knowledge that you need to pass the exam and be a pathologist, you need to see and do as much as possible through your day-to-day work. I'll just mention this briefly. It's probably not relevant quite yet, but you should try to get to do some independent reporting throughout your training. Well, certainly probably from ST2 onwards. And just below the curriculum and syllabus documents, there is a document on independent reporting, which will talk you through how to do that. And really, you should keep an audit or a record of the independent reporting that you are doing and have that signed off by your clinical supervisors, so that as you rotate to different hospitals, you can take that document with you as evidence, just to help you in picking up independent reporting quickly in a new department. Finally, just wanted to mention some of the assessments that you will be expected to take part in during ICPT. As Joe has already mentioned, there are the supervised learning events, which you are expected to complete every year, and there are 24 of these per 12 months, and that's pro rata if you're working less than full time. There are 6 direct observation of practical skills, 6 case-based discussions, 6 evaluation of clinical events, and 6 AOPs, or assessments of performance in the workplace. So 24 of these to complete in the year. And again, how and when you do these probably vary slightly by where you are working, but I would suggest that you do these throughout the year rather than leave them to the end of the year. You will be expected to undertake multi-source feedback at least 3 times during your training program. However, again, this varies by deanery, and certainly in the Northwest, we do multi-source feedback every year. And finally, in order to progress into the next stage of training, you need to pass the Part 1 examination. This is my last slide, and this is just where when I mentioned there are some things for you to start thinking about even at this very early stage in your training. And the first one of these is to consider what you want to do finally for your specialty training. In other words, what do you want to have your CCT in? Do you want to have a CCT in histopathology? And if you do, you don't really need to do anything. You just pass the Part 1 exam and continue into high specialty training in histopathology. 2 things you do need to consider, and that's whether you want to sit the exams in higher autopsy training and higher cervical cytology training. And I would urge you to consider very seriously at least one, if not both of those. Particularly autopsy training is going to be a very useful skill to have. Since this has become an optional part of training, a lot of trainees have dropped this. And you will find that actually a lot of departments now are short of pathologists who have this qualification, and you will be in real demand if you do have this certificate behind you. And the same goes for the cervical cytology exam. People have thought, I don't need to do this because it's a difficult exam and I don't need to do this to get a job. There are several posts across the country in cervical cytology, and if you have this certificate, I can tell you you're almost guaranteed of having a job in one of those centers. So really do consider doing those exams. you will get a lot of support from the local departments who are offering these services nationally. And if you are interested, please speak to your TPDs and to consultants who are doing either cervical cytology or autopsy work. You might then also want to consider going into one of the other specialties. So forensic pathology, pediatric and perinatal pathology, and diagnostic neuropathology. And again, there is, I think, a shortage or a dire shortage in all of those specialties. These are all very interesting. They make really interesting careers, plenty of opportunities for research and training. Please do make sure you get some experience of these, and if they are of interest to you, please again speak to your TPDs or to trainees or pathologists in any of those specialties. And finally, you might just want to consider whether at some point within your training you want to undertake a period of research, whether that's a PhD, an MD, a PG cert. And so you might want to consider whether you need to take a formal period out of training, and you'll need to discuss that with your TPD as early in your training as possible. So never too early to start considering all of those opportunities and options. And then finally, just to say very good luck. That really was a whistle-stop tour through the curriculum. There's a lot more information on the website, so please do have a look on that. Thank you.
Thanks very much indeed, Ed. The curriculum can be a very large and daunting kind of document, so I'm sure after that guided tour, the trainees participating in this morning's webinar will feel better able to approach it and use it during their training. So thank you very much. And I see we've got some questions during your talk there, so you've clearly stimulated a few thoughts, and we'll come back to those at the end in the Q&A session. So everyone should feel free to add any more questions that you'd like to as the morning goes on, and we'll pick them up later. But for now, we're coming back to Michael, who you met earlier, and Michael is going to talk to you about how to use the LEPT system, which is the e-portfolio that you'll use for documenting lots of your training as you go through. Over to you, Michael.
Hi again, everyone. I'm just going to share my screen. You should now see the college homepage. If you don't, please do let me know. So as I mentioned earlier, one of my main roles is to respond to all queries regarding the LEPT e-portfolio. I'll give you a very brief demonstration of the LEPT e-portfolio, but first let me just give you a little bit of background as to what the LEPT system is. So as I say, it's the e-portfolio that you will use to record all your progress throughout your years of training. It's used for recording workplace-based assessments, the multi-source feedback assessments, and it also has a functionality to support your annual review of competence progression process, and also provides the educational supervisor structured report known as the ESSR, which is a document that gives a snapshot of your year's training. So I'll now just give you a very brief demonstration, but do note there are some more in-depth instructional videos, and I'll show you how to access them a little bit later on, but they really are your main point of call if you are struggling to do something in the LEPT system. To log into LEPT, you just need to visit rcpath.org and click down here in the new LEPT system. This will bring up the single sign-on page. You will need to enter your registered email address and also your college password, which I think now should have been set up. So I'm just going to log in here. And on this first page, you will see the types of access that you have to the LEPT system. So for all of you in your first year of training, you will just see Trainee, and we'll click continue. Now, upon your first login to the LEPT system, before you see this home page, you'll see a separate page which will ask you to enter the names of your educational supervisor and your training program director. Without selecting these, you won't be able to get into the homepage and use the system, as these are mandatory requirements to use the LEP system. So this is the LEP homepage for an integrated cellular pathology trainee in that ICPT specialty. This blue bar up here is your navigation menu. You've got the release tab here, which is one place where you can update any of your professional relationships. And you've got the alerts menu here, and they will let you know anything, any alerts such as LEP downtime. And if you click into this middle alert, you'll be taken to the YouTube links for the instructional videos that I mentioned earlier. As I say, they'll just give you a bit more depth into how to do various things in LEP. There are currently 16 videos on the trainees playlist, so do watch through them as you're using your ePortfolio. So you've got the tasks menu here as well, which shows any items that are requiring your attention. You've got a message function over here where you can message other LEP users. And then so you've also got the training card down here, which is quite an important function in LEP. And this will operate once you've created your ARCP, which I'll show you a little bit later on in the demonstration. But it will list your year of training, the status of your ESSR, which is usually done at the end of the year. And it also lists your professional relationships. For the purpose of this video, all of these names are college staff. The ARCP panel chair and ARCP representatives will be told to you later on during your training year by your training program prior to your ARCP, as you don't need to worry about setting these at this point. And as I mentioned earlier, it is just these two up here that are mandatory for using your ePortfolio. So I'll just show you a few things in the ePortfolio. I'm going to go into this, these three horizontal bars up here. They're called the burger menu, and we'll click into profile. As the LEP system works through a single sign-on, you can only change your email address by notifying us at the college or by changing it yourself on the college website. And if you do this, the LEP system will be updated the following working day. So on that day that you update your email address, you'll still need to use your old email address to access it. And then on that following working day, your new email address will be live in the LEP platform. Do note you can also load a photo, but do bear in mind anyone with reading access to your ePortfolio, those people are those professional relationships that I showed you earlier in the training card. They will be able to see your photo. I come down here to the portfolio user details. So you've got the anticipated completion date up here. If you do feel that that is incorrect in your ePortfolio, please do let us know, and we'll work to get that amended. List your year of training and your job position and workplace, which you can set yourself by going into the edit tab down here. You've got your GMC number if we have it, and your national training number, which is a mandatory field on the ESSR, which you'll complete later. And you should be able to get this from your training program or deanery. So as I mentioned earlier, the first thing you'll need to do in the LEP platform to get that training card function working is to create your first ARCP. So you'll just need to go into ARCPs up here and click into create and list. On clicking into that, you'll see the create tab, which will show around where my mouse is now. It's not on the screen for this trainee because trainees can now only have one open ARCP at a time. And we set this one up earlier for this demonstration just to show you how that looks. So when you go in to create an ARCP, you'll be asked to put in your ARCP date. You can use a fictitious date at the moment, just an estimated date, because you may not have been given this yet. It's usually around the May or June time. So I've just put 10th of June here, and you can change that later on. The period dates down here cover the whole training year. So I've put in the 1st of August, this August in 2023 to run through to the end of July next year. You can see the status of your ARCP and also your assigned items. So at the moment, this ARCP is empty. And once you've created your ARCP, you can start to send your assessments off. As Dr. Cheesman referenced earlier, your different supervised learning events or workplace-based assessments, as they're termed in the LEP system. So if you go up here and click into create and list under assessments, and you'll see the create tab up here to begin your assessments. Just before I talk about the workplace-based assessments, I will point out the multi-source feedback assessment. It does mention down here, it will be initiated by the college in your ST1 training year. So please don't worry that you can't see a create tab next to the MSF assessment, because the college will do this for you in your first year, and this is usually done in February. And then once you become an ST2 trainee, you will be able to start your MSFs at any point throughout your training year. So I'll show you how to set up a workplace-based assessment here. As you use LEP users as assessors throughout your training, they will appear in this previously used list. But for your first assessment, you will have to click into Other and Find. And once you've selected your assessment tool here and go into Create Assessment, you'll be given the list of all the available assessors in LEP. If you're not able to find that person, you can come back to this page and go on to Guest Assessor, where you'll put in their email address and their name. If you do that, please do ensure that the email address is correct, because if you don't put the correct email address in for the guest assessor, your assessment will not go to them and will just sort of disappear, and we'll have to let you know about that so that you can amend the email address on that guest assessment. But for now, I'm just going to select myself as the assessor, and we're going to just look at an evaluation of clinical management events assessment tool, which is the ECE. We'll click into the create assessment. So the top part of the forms are auto-populated, but you can amend the date. If needed, it might be that you need to amend it to yesterday's date, because you've only just got onto LEP to put all the details on. And then any fields that are mandatory for you to complete as the trainee are marked with the red asterisk, as you can see. So you set the status of your assessor, and then for the ECEN, this is the same for the other workplace-based assessments. You'll have various trainee fields that you need to complete with the red asterisks next to them. And when you get to the bottom, there's the feedback section. And there is a message here that explains what I'm about to say, but you can fill these out if you wish. It might be that you've had a discussion already with your assessor, and you might want to sort of briefly detail that, but your assessor will have ultimate ability on what is in these fields when they get your assessment, so they can delete what you've put and put their own stuff, or they can reject the assessment and ask you to amend what you've put into your fields. So what I'm going to do is, once you've completed this, you'll submit it to your assessor, or you can save as draft down here. But once you've had your assessment approved by your assessor, it will come back to you to associate it with the SIPs and GPCs that Dr. Cheesman just talked about in his talk. So before you see your assessment appearing in your training card, and I will just quickly, I realise I didn't point this out, in your training card you can see the indicative numbers of all the assessments that you need to complete during your training year. And before, although this DOPS assessment is what's up here, although that's been approved, it won't appear down here yet, because there's a couple of things that you still need to do. So the first thing is to associate it with the capabilities in practice and the GPCs. So you'll need to read through these carefully, but just for the purpose of this, I'm going to select a couple of these SIPs, and based on what you've put, the GPCs will auto-populate down here, depending on what is linked to a GPC, but if relevant, you can edit these if you don't feel that one is relevant to the assessment. And then you can just add the GPCs and SIPs. And then the final thing for you to do, you'll need to go into options up here, click into ARCP, and then you will need to associate it to your ARCP. So that ARCP that is open and is showing there, we'll assign it to that ARCP, and we'll go back to the home page. At this point, and only this point, will we now see that we've completed that DOPS and we've got the green light in our homepage and we've ticked off an assessment. Now, all of 4 of these workplace-based assessments work on this premise that they've got to be associated with the SIPs and the GPCs and the ARCP before appearing in these checklists. So I do make sure that you have done each of those steps. And obviously, as I mentioned earlier, your MSF you will have an MSF in your first year, but that will be initiated by the college a little bit later on in your training year. So I'll just now very briefly show you a few of the other things you can do in LET. But as I say, there is an instructional video for every function. You can watch through in a little bit more detail, but I'll go into the personal activities. And this is where you can add any activities you might want your ARCP panel to see when it comes up for your review. So you can have things like audit or a logbook, or you can even add your attendance at the trainee welcome day today. As you can see, this dummy record has got here. So yeah, and these personal activities will populate your ESSR. So when you complete the ESSR at the end of the year, your educational supervisor and your ARCP panel will be able to see all of the activities you've done during your year. And similarly, resources is where you can upload any files or certificates that might evidence things that you've done. So you can also put the certificate of attendance up for the National Welcome Day, or you can, the new trainee welcome day, I beg your pardon, or you can upload any certificates of meetings that you have attended in here. And that again will all be seen by your educational supervisor and ARCP panel as evidence of your progression. And finally, the training rotations. This is where you can add all of your different posts during your training. So where you've done placements, the percentage of your training time at that placement, and the dates. And it's important to keep this up to date actually, because these do auto-populate your ESSR. So if you do keep this up to date, then at the end of your training, your ARCP panel will be able to see all of the different places you've been and the different dates you were there. So in a nutshell, that's a very brief overview of the ePortfolio. I will stress again though, do visit the videos that we've done that will give you a little bit more help. But additionally, you can always send queries in to us. Joe showed our email address earlier on. That was assessment@rcpath.org. Or on this help tab where you'll see there is various documents where you can view. So depending on your specialty, you'll all be interested in the cellular pathology one here. You can see your indicative numbers throughout all of your years. There's other information documents here. And you can also, beg your pardon, you can also click into the report issue section where you'll be taken to a page where you can just sort of like any sort of website, you can do a sort of contact us thing, and that will come directly through to the department. So that's just another way of logging a query, which we'll always aim to respond to as quickly as we can. So thank you very much for listening. And if you do have any questions, please do put them in the Q&A function, and I'm sure myself or Sandra will be able to answer them later on. Thank you very much for listening.
Thank you, Michael. I'm sure people will be keen to look back on your presentation in the webinar as they get to grips with LEPT over the next few weeks and months. So that's great, and I can see that we've had lots of questions coming through in the Q&A tab, and I can see also that quite a lot of those questions have been answered already. So if you'd like to dip in there and have a little look at how the questions have been answered, you'll be able to see that as we go along, and feel free to add some more questions as they come to you. So our next presentation this morning is from Professor Nicki Cohen, who is the Clinical Director of Examinations at the College, and she's going to give you an overview of the RCPath exams. Thanks, Nicki.
Hello, everyone. I'm going to try and do one thing at a time, which is always difficult for me. But it's lovely to see everyone today. And the easiest way for me to do this is to say that if you're really wanting to understand about exams, then actually the place to look at that is the website. There's almost nothing that I'm showing today that isn't available on the website. So I really would encourage everyone to just go and have a look at that. It's the perfect place to find stuff. Pretty much everything is on there. And it's far easier than me just saying, have a look at the website. But actually, for pretty much every question that you're going to be asking today, and as you come to prepare for exams, that's the first place to go, because really everything is there. So I'm a neuropathologist by background. I trained, I finished my training about 15 years ago now, and I work predominantly in medical education. I still am a practicing neuropathologist, and so obviously that's the area that I know most about. But as one of the 4 cellular pathology specialties, there are lots of overlaps and lots of similarities here. I would say, don't be afraid to ask questions of the exams team if you need to along the way. We are all here to help. It can be quite daunting, of course it can be quite daunting, but we are here to support you in all of this. So just as a recap, and I know that lots of people will have shared this sort of thing today, the college runs lots of exams. It runs lots of medical and associated clinical specialties. The 4 cellular pathology specialties have one part 1, which is sometimes known as the histopathology part 1, but it's one cellular pathology part 1 exam before you can stay and run through training in order to become a histopathologist beyond integrated cellular and pathology training, or you can specialize at that point through an application process in either of the other 3 smaller specialties. But it does allow you to have that run through element for the majority of you who will want to become histopathologists, or with some further specialization as needed. Because we run lots of different exams, we run more exams than lots of the other colleges, it does sometimes get a little bit complicated. But as I say, email in, ask, have a look at the website. There is lots of information that's available. Now, people always focus on exams, and that's normal, and certainly when I was a trainee I was exactly the same. We all are, but I think it's important at the moment just to put this in context. So exams are one of the ways in which you are assessed. They are the high stakes assessment. We all know that you need them at the end, but they are one of the requirements for your progression. You can't leave ICPT without part 1. But it's just one of the elements, so it's not more important than your ARCP, because these are all measures of your progression, if you see what I mean. They form the important gateways. So on passing part 1, and we would tend to suggest that people do a minimum of a year and generally have had a go at it by 2 years of their ICPT. If you want, you can apply for diplomat status at that point. You don't need to. The postnominal is an optional extra, but it is there if you like it. The part 1, of course, is the first part. Part 2 comes afterwards. Once you have part 2, of course, that's not the end of your training. It's really easy to think, right, I've got to get the exams and then I'll get consultant post. In reality, there's part 1, there's part 2, and then there's GMC approval through the CCT route or CSER route, and of course, is the equivalence. But part 2 doesn't represent the end of training. It's the second hurdle, the second big hurdle. But it's not the only way to get membership for the Royal College or fellowship of the Royal College. And indeed, it's not sufficient by itself in order to appear on the specialist register, which is where you're all heading. It is also possible to gain fellowship of the Royal College through published works. That doesn't associate in the same way to being able to work as an independent clinician, but it is there for some who work in different ways and who still want the regard, which is entirely reasonable. And CSER, again, of course, as equivalent to CCT, is another route to think about, but we would expect that most of you, particularly for where you are in your training and for joining us today, would take the CCT route. So just because I might not have said it enough, but all the exam regulations and the guidelines are available on the website, and I'm not going to go through them all today because you will already be at information overload point, and I realise that. But as a general premise, it's worth stating here that you de facto have 4 attempts at each exam as standard. We do provide reasonable adjustments. We're very proud of the way that we tackle that, and the way to manage reasonable adjustments, and for you to seek some assurance around that is, again, to contact us early. But you certainly need to be applying for those at the time you apply for the exams. It is better to speak to us early where you can about them. We do have policies and procedures for mitigating circumstances. For those of you who want to raise an appeal, for those of you who want to issue a complaint about the exam, these are all managed slightly differently. There is a protocol, again, it's available on the website. And just to say that, of course, all of our exams work within the constraints that are the GMC standards for education and training, that we hold dear, that we work to very closely. And we need to go through those processes to change an exam. And it's you know, those are that is our regulator. That is the way that we're working. So the part 1 exam, and that'll be some way off, but it might be something you're beginning to think about fairly soon, is a mixture of single best answer and extended matching questions. It's a 3-hour exam that happens in one go, online, through Test Reach. And if you look on the website, you'll see the way that you apply for the exam. And in order to apply for the exam, you have to have approval from a fellow. So you have to submit that form. But then that'll take you through a registration process with Test Reach in order to sit the exam. You need to kind of get ahead and get registered with all of these systems in advance. Don't leave everything to the last day. Further exam information is available on the website. I probably should have a penny for each time I've said that today. Haven't finished yet, but there is lots of information around. If you look on the website, you'll see examples of part 1 questions. Many of you will hear later about the pathology portal, which isn't yet there to prepare you for exams, but it is a useful source of information for tests and similar kind of experience, it's fair to say. The part 2s differ depending on what specialty within the cellular pathology family you end up in, but recognizing that most of you will end up doing histopathology, in terms of part 2 information, that's what I'm showing today. Part 2 is all face-to-face, so not online, and certainly that's the way that it is at the moment. We try and schedule you with a nearby venue where we can, unless there's a conflict because an examiner is one of your trainers or something like that happens. The part 2s for all of the cellular pathology specialties are very involved. They involve lots of different aspects, assessing lots of different aspects in the way in which we work. For histopathology, that happens over 2 days. For pediatric and perinatal pathology, it usually happens over 3 days. We use a very clear system of closed marking by trained examiners. There is a small amount of feedback that is available afterwards, and we're working on ways to improve that at the moment. It's safe to say that we are not here to catch you out. The point of the exam is to demonstrate that you are good enough, that you have reached the required standard that is needed for independent practice, for assured practice for assuring patients whom we are responsible for maintaining patient safety in, as you will be as well. The way to prepare for exams is to see lots. So the way to prepare for exams, particularly the part 2, is to shift a lot of glass, to do a lot of cases, to develop a practice whereby you're seeking feedback from your trainers for every case that you can, whether that's formal feedback through the LEP system, or whether that's just, we just reported a case together, how did I do? But really get into that mindset early, because it'll pay dividends in the end. So changes to exams, of course, happen, and I haven't given you a lot of detail, because by the time you get to part 2, it's quite possible that some of these will have changed as well. We do go through a tightly regulated process, as you might imagine, with the GMC. So to apply for changes takes some time. We need to work with the GMC in order to do that. We need to run a pilot for the more substantial changes in order to do that. And these are similar processes that are undertaken by all the other Royal Colleges. The Royal Colleges together in exams work together through the Academy of Medical Royal Colleges. So there are very similar processes for all of these governances, if you like. We're very aware within the college of the effort that it takes to sit exams for trainees, but also, of course, the cost that is required and the consequences of passing or not passing. So there is a lot of information again on the website around why the costs for the various exams are what they are, how often we review them, how we look at how the money is spent, how we look at how we can optimize that for medical exams, because they are an absolute requirement of training. There is the ability, of course, to apply for them within your tax framework, and there's more information for that available online as well. Just to say it once more, everything really is available online. Do take a good look when you have some brain space to digest this, and when before it becomes important for you. But everything is there. You're going to be our future colleagues. We are here to make that journey and that transition as good for you as we possibly can be. We are reliant on you as a future workforce, and patients are reliant on you, of course, in terms of patient safety. We don't take failing candidates lightly. We aim not to have to fail you. We want you to pass. And I'll probably stop here by wishing you the very best of luck. Thank you.
Thanks very much, Nicki. And thank you for being so brief and succinct in your talk. And we're well ahead of time as a result of you and all the other speakers being so efficient this morning. So thank you. I've been having a look through the questions, and in fact, we can see that most of the questions that have come in have been answered already. And as we are running ahead of time, I thought we could probably perhaps answer one of those now as we go. And I see that there is a question has come in about workplace-based assessments that Sandra would be happy to take live. So I wonder whether now would be a good time, Sandra, for you to pick up this question, which is, can a workplace-based assessment be completed by a BMS or MLA? Sandra's being uncharacteristically shy. Maybe I've taken her by surprise. I have indeed, and in fact, I see that. Oh, sorry, Ed, you've appeared.
I can try to answer that. I think the answer is probably, except I think whoever completes your WBA should in a way be approved by your educational supervisor. I don't think there will be any issue in a long-standing BMS signing off a WBA or even an MLA. But just be sure that your educational supervisor is happy with that. I guess the only thing to ask is whether, I suspect that whoever does it needs to be registered on the LEPT system so that they are able to log in and do it. So I guess that is the only challenge. And I'm not sure whether how easy that is to do.
Thanks very much indeed, Ed.
Maybe Michael can help us on that one.
If Michael can't, I can. Yeah, there is a process to get anybody registered to be able to assess you on the LEP system. So that's absolutely fine. I can see Michael's appeared, so he probably knows better than me how that actually works.
I was just going to point to when I showed earlier the guest assessor. If it's not a registered assessor on the LEP system, you can add the guest assessor and just put their email address in and their name, so that person's name will be put on it, and obviously that assessment will be seen by your educational supervisor. So you know, you'll need to just check with your educational supervisor first if they're happy for you to use that person as an assessor. But yeah, if they're not on the system, they can try to get registered on the system coming to us, or you can just add them as a guest assessor.
Super, thanks very much indeed, everyone. So I see that we're ready to move on to our next speaker now, who is Dr. Esther Yaud, and Esther is the Clinical Director of Digital Pathology Education, and is going to talk to us today about the pathology portal. So I'll hand over to you now, Esther.
Thanks, Ronan, and thanks for the invitation to be here this morning. Morning to everybody who's joining us. I can't see you, but I'm assured that there are lots of people here interested in this. So I am just going to talk to you about the pathology portal. I'm just going to share my screen and hope that works. Okay. So the pathology portal is an online educational platform that's been put together by various members of the college, including trainee members across various different pathology specialties. For histopathology in particular, we ensured that this platform was able to deal with whole slide images, so digital histology slides. It contains a wealth of educational resources, including some whole slide images. I know that there are many ST1s that have already signed up for the pathology portal, and that's great to see, but I would encourage you to sign up and start exploring what's there, hopefully get some educational benefit, and also give us some feedback about what's there and what else you want to see. First of all, if you haven't signed up yet, you need to go to the Learning Hub and create an account. So the Learning Hub is run by NHS England, and it aims to be the central place for all online learning in healthcare. If you have an e-learning for health login already, then your e-learning for health login will work on the Learning Hub. You can also log in using Open Athens as well, but it's really simple to create an account. If you go to the Learning Hub website, the page is here on this slide, and click to create a new account. Then you can sign up as long as you have an NHS or an academic email address. This process is really, really simple. If you don't have those, then we have a team of people at the college who can help you with your registration. But for most of you, that should be really simple. So you sign up for a Learning Hub account, and then you need to log in to select the pathology portal. So once you get into the main system and you scroll down, you'll find the pathology portal catalogue, which you can click through. You can see on this page, this is a screenshot from me, and it says that I've got access granted. When you first log in, the access is restricted and you need to request access to the pathology portal. And we usually respond to that within just a few minutes. So it's very, very quick to get your access sorted out. Once you're in, this is basically what you'll see. This is the main pathology portal spine. These are all taken from screenshots because basically giving this talk at lunchtime, I didn't trust the Wi-Fi being quite good and slick enough to be able to demonstrate this to you live. But as you scroll down on this page, you'll see all the different pathology specialties listed. Now, some of them have live written next to them, some of them don't yet, and that basically reflects where we've got a good level of content, which we've been able to launch live. And we did that for histopathology last August. So we've had a whole year of the portal being live for histopathology, and that includes autopsy pathology, dermatopathology, and neuropathology as well. We're still building on the content in paediatric pathology and many of the other pathology specialties. But there's a lot of content across the different specialties in histopathology and autopsy. So you can just click through these sections. I'll show you the autopsy one because this is what I've contributed the most to. And in the autopsy section, it's all broken down by the organ systems. As you click through, you'll mostly encounter this sort of level 1 to 5 arrangement. This is supposed to represent various different levels of complexity, going from level 1 being basic to level 5 being the most complex. And it roughly equates to an ST1 to ST5 kind of level, but also reflects the fact that people learn at different speeds, get experience at different levels. So for example, when I was training, I didn't see any testicular tumours until I was probably in my 3rd or 4th year, and then coming up to preparation for the Part 2 exam. So there wouldn't be any point in me looking at level 3 or level 4 stuff at that time. I needed to start back at level 1 and build up my experience in testicular tumours. So it just kind of gives you that idea about the level of complexity, but you are able to work through the levels as you wish, really. This is an example of an autopsy case. So here you've got a bit of clinical information at the top. Then you've got a whole slide image here of the left ventricle. This is a section of somebody that's had a myocardial infarction and a rupture through that, which is why you can see this is a sample of heart with lots of hemorrhage and a rupture through the ventricle. This particular case also has a video. So this video, when you click on it, is me talking through the histology and demonstrating the various different features. And then you've got some photographs of some of the features there as well. So this is just an example of the type of thing that you might encounter. Different resources have different amounts of information or lend themselves differently to different media to present the educational information. There's often questions as well, just testing your knowledge. None of that is seen by anybody other than yourself. There's a record kept in the Learning Hub of which resources you've accessed, but nobody sees whether you got the answers right or wrong. So, so you can play around to your heart's content and hopefully get some learning from it. Just wanted to point out the search function as well. Back on the main pathology portal page, there's a function for search catalogue. And this is an alternative way of working through the material present. So if, for example, you wanted to see something on a particular topic, for example, bone tumours or hypertrophic cardiomyopathy, or any kind of topic that you like, you can click on this search function and search for that particular topic, and then it will bring up all resources related to that. So that's quite a handy way of looking through. So if you're dealing with something in your day-to-day work and you think this might be a case of a seborrheic keratosis in the skin, then you can come to the portal, search for seborrheic keratosis and see all the examples that we've got on there. Finally, just to point out that you can get easy access to the portal through your college website, account. So if you're logged into your account on the college website, this drop-down menu that you see from my RCPath, you can see down near the bottom, it says access the pathology portal. Now I've already got my account, my college account, linked to my Learning Hub account. So I can click on access the pathology portal, and then it takes me straight to the pathology portal. I don't have to log into the Learning Hub separately. That won't be the case for you yet because your accounts won't be linked, but when you click on this drop-down menu, you'll have the option to link your account to the Learning Hub. So that just helps with logins. Finally, just want to say we really do value feedback. We want you to use the pathology portal, and we want you to let us know what you like and also what you don't like, or what you think would be helpful to be added. We're adding content all the time. We've got a large editorial board, both consultants and trainee editors that are adding new material all the time, and we really value your input so that we manage to get the right stuff on there that helps you with your training. So please do get in touch, and if you want to get involved with actually contributing cases, then we would welcome that too. Thanks very much.
Thanks very much indeed, Esther, for that run through the pathology portal. I have been keeping an eye on questions, and most of our questions have been addressed by everyone on the panel here just as they've been coming in. So I don't think we need to discuss any more of these just yet. Our last speaker is Dr. Rachel Rummery, who's the Vice Chair of the Trainees Advisory Committee at the College. And Rachel hasn't joined us just yet, so I think that we should probably have a short break for about 10 minutes or so to give Rachel a chance to get on board. In the meantime, we'll keep taking your questions as they come in and producing some answers for you in the Q&A function, and we will see you again at 12 o'clock and proceed with the seminar then. So I hope you'll enjoy a short break, and we'll see you again at 12 when we'll pick up the rest of your questions and hopefully have Rachel with us. Thank you. So thank you for joining us a little bit early, Rachel.
No worries.
And Rachel is the Vice Chair of the Trainee Advisory Committee at the Royal College of Pathologists, and I'll let Rachel introduce herself, but she's going to talk to us today a little bit about the Trainee Advisory Committee. Thanks very much, Rachel.
Thank you very much, Ronan, for that very kind welcome. Can you hear me okay?
Yes, we can all hear you.
Perfect. So as Ronan says, I'm here to talk to you about the RCPath Trainee Advisory Committee. I'm Rachel Rummery. I am currently a Specialist Registrar in Paediatric and Perinatal Pathology in Yorkshire and the Humber, and the current Deputy Chair of the Trainee Advisory Committee in the Royal College of Pathologists. I'm also Vice Chair of the Academy Trainee Doctors Group in the Academy of Medical Royal Colleges, and a trainee representative on the HEE Neurodiversity Group. I was previously the HE Clinical Lead for Return to Practice. I do want to give some credit here for the slides, or some of these slides, to the immediate past chair of the RCPath Trainee Advisory Committee, Dr. Matthew Clark, who did an enormous amount of work in this space. So first of all, on behalf of the Trainee Advisory Committee, I'd like to just say welcome to pathology. Okay, you have chosen a really, really excellent specialty, and we're really very pleased to welcome you. Obviously, I think it's an excellent choice, and I'm sure everybody else does here. It's a very supportive and inclusive specialty with so many interested and varied career paths. So like I say, that's the most important bit, really. Welcome and make sure you enjoy it. But I'm here to talk to you about the Trainee Advisory Committee, also known as the TAC, who is, or it is, the Committee of Trainee Representatives. There is representation on the committee from all 17, I think that's the right number, of the pathology training specialties. And the trainee representatives also sit on other committees. I sit on the examinations committee and also the Equality, Diversity and Inclusion Network. Other people can also sit on things like the Medical Examiners Committee. We provide a report for the TAC meeting of relevant information, that's the specialty representatives. And the Trainee Advisory Committee meets twice a year, but does have contact with the college and of course trainees throughout the year and at any point as required. It's highly valued by the college as a really excellent resource and a really good interface to get to know trainees and their issues. And we work very closely with all members of the college. So the role of the TAC is to represent every single one of you as trainees. We can, as your representatives, put forward your concerns or queries to the college. And obviously some concerns and queries may be things that are college related. Some things are not college related, but they're still always very happy to hear about them. It may mean it's harder for them to fix them, of course, but all input is valued. We review documents, curricula, and provide trainee input for various projects for which we sometimes put out requests for volunteers who aren't on the representative committee. And the whole aim really is to try and make life easier for trainees. If you do have any concerns regarding your training, it's important for you to let us know so that we can try and take it forward. As I say, whether or not the actual issue can be taken on by the college or not, it's important to know. There's also the opportunity often to make contributions to the trainee section of the college bulletin. And many of us have written articles for the college bulletin. So this is the college webpage. If you have a little look, it's easy to find. And on there, you will find, I hope, who's actually your representative. The current chair at the moment is Dr. Sophie Roberts, who took office in, I think, February. She is an infectious disease trainee, and meantime, as I say, there are representatives from all the other specialties. I am the paediatric pathology representative as well as the deputy chair. So how does it work? So the Trainee Advisory Committee meets in May and November every year, and 10 weeks in advance, trainees are asked to submit questions or queries via the website. There's usually also a little reminder that goes out to say, is there anything you want to raise? And it's very variable. Sometimes people raise lots of things, sometimes people raise none. I've been fortunate enough in some ways, or unfortunate in others, to represent a specialty with very few trainees, so I haven't had that many issues to raise, but the representatives from the bigger specialties can often have quite a lot of issues raised. These questions are then given to the Director of Learning and Director of Examinations, who very kindly formulate a response. And every question and query is discussed in the meeting, that's the Trainee Advisory Committee meeting, with the college officers. The Director of Learning, the Clinical Director of Training and Assessment, the Vice President of Learning, and the Director of Examinations. The trainees then receive a formal answer to their query, which I think is put on the college website. And also in the meeting, we get an update from the president, and very kindly, we get really fantastic administrative support from the college, particularly Louise Mayer. So there's quite a lot of activity and projects going on in the TAC and ongoing work, because some things have been ongoing work for a very long time. So these are some of the examples, many of which were done by Matt as the immediate past chair. So there's been anti-bullying and harassment campaigns. There has been, I think you've already had a talk on the pathology portal, a lot of work done by the trainee committee on the pathology portal. Wellbeing and support, I say listening to trainee issues. Reporting of errors and mistakes, usually obviously relating to training issues. Diversity in the college, as I say, I represent the Equality, Diversity and Inclusion Network, and the chair often attends as well. The RCPath BDRP Foundation Undergrad Taster event, we usually contribute. Matt organised an excellent Not in This Textbook study day later last year. We took part in the COVID-19 Impact on Training survey, the What I Wish I'd Known series, Art and Science of Practical Management, which was a college course, I think, last year. National Pathology Week, we do lots of events and get involved in them. And I suppose it's worth pointing out at this point that the Trainee Advisory Committee is not the only way you can get involved in the college. I will touch on that a little bit later, although I'm sure that's already been mentioned today. We give feedback on examinations and assessments and lots more. Plus, it's trainee driven. If you have an issue you want to raise with your representative, or you become a representative, then that work stream can be taken forward. You've already heard about the pathology portal, but as I say, trainees had a great deal of input into that, and Matt in particular did a great deal of work on it. The approach to training from the committee is to share information. We want to talk about your issues, we want to scope the horizons for new opportunities, and we want to take learning forward as best we can. As regards wellbeing and support, again, that's obviously very important for the committee, and that's the kind of issues that can be raised. So whilst it obviously depends exactly which is the appropriate forum to bring these issues forward, help is available if you're struggling as a trainee, and look out for each other. Engaging with coaching and reflective partnerships is important, and obviously speaking with supervisors and TPDs. Mentoring, some people do indulge in mentoring either formally or informally. Speak to us on the TAC and think hard about your work-life balance. So as I say, these are mostly general things about wellbeing and support, but again, feel free to speak to us on the TAC if you feel we can help, or if it's particularly a general issue that you think might be affecting more people than just yourself. As regards communication with trainees, this has actually got Matt's picture on it. Currently at Pathology House is the Twitter feed for the Trainee Advisory Committee. This is obviously now run by Sophie. This will update emails through the year. There are Twitter updates on Pathology House. There are features in the RCPath bulletin. We're working on one at the moment. And essentially, we are doing things for trainees all the way through the year, not just the 2 meetings I've talked about. So, can you get involved? Well, firstly, absolutely. We need support and help from the trainee body, partly because we regularly seek representation, but also because as representatives, we will often ask if anyone would like to get involved, seek for volunteers, ask people about issues, surveys, etc. It's all really important stuff, and we really want to get involved with everybody. So please do. And I suppose this might be a good moment to say that you don't have to just get involved with the TAC. There are so many other things you can do to get involved with the college as a trainee. Which brings me on to, I think, what are perhaps the myths about college involvement, not just for the TAC, but in general. But for the TAC in particular, I think there's a sensation that you need to be what you might call a perfect trainee with a perfect record to get involved. That's absolutely not the case. It is sensible, obviously, to give yourself a bit of time to bed in once you've arrived in training and just started. And obviously, if you're going to take something on, make sure that you're in the right frame of mind, you've got the bandwidth, and that you've got the time to get involved with what you want to commit to. But actually, in some ways, you can get involved in the college whenever you want. And actually, being junior can be an advantage because you're more away from your main exams, which actually can make it quite challenging if you're trying to be a representative, or in my case, a deputy chair. So being junior or being different isn't in any way a problem. I'm a very diverse trainee myself. I had a very long career break, and I've spoken in the bulletin about being neurodivergent, for example. But there are so many ways that you are different, and the college is a very welcoming and inclusive environment, and all contributions are valued. As examples of the kind of things you can get involved in as a trainee that aren't the TAC, I did the science communication course, which was brilliant. It meant that myself and a friend, fellow trainee, presented at the Science Museum at one of the lates. A few years ago, the college did the Blood and Bugs roadshow. Trainees were valued there and got involved in that. And it's things like that all the way through the college. You can get involved, even if you don't decide you want to try and be your specialty representative, or of course, if that post is already filled, but you still want to get involved. Because I say, the college is very welcoming, it's very inclusive, and all contributions are valued. So if you do want to get involved, then keep an eye on the college website for opportunities. Follow us on Twitter, and obviously always feel free to contact the chair, whose email is there, or for that matter, myself, although I am likely to demit before the end of the year. So I hope that's given you a taster to what we do in the Trainee Advisory Committee. And any questions?
Thanks very much indeed, Rachel.
Yeah.
I have been keeping an eye on the Q&A section down at the bottom, and while you were chatting, someone has put a question in for you. Mm-hmm. And that is, Rachel, you mentioned something to do with neurodiversity, but I missed it. So would you mind just briefly recapping on that?
Oh, it was just literally that I happened to be the trainee representative on, well, it was Health Education England, and I always forget their new name, but previously known as Health Education England Neurodiversity Forum. I'm the representative on that. It was just something I actually do.
Great, thank you very much. Well, that is the end of our formal presentations today. So I'll have another quick look at the Q&A section just before I so yes, just looking at the Q&A section there, there are 17 questions in it which have been answered, which answers have been provided for. You can have a look through those now as we go, or you can read them when they're published on the website along with the webinar next week. But I'll keep an eye on these just for the next few minutes as we wrap up here, and if anything else comes up we can pick it up. But hopefully this morning's webinar has given all of you a feel for the college, a feel for how the college will support you during your training, and hopefully you've got an idea of the people that you might encounter whenever you need help and ask for help from the college. So I'd like to thank all of our speakers today for coming and giving of their time and setting out the role of the college in your training. And I might just take a moment or two to ask if there's anything that any of our speakers would like to add or would like to clarify, having looked through the questions themselves and having answered some of those questions, in case there's something that you'd like to expand on. So it doesn't look like it. So thank you all very much for coming. I hope you found this morning useful. It's been great to see so many of you. And as others have said on this morning's meeting, welcome to your training in pathology. And I wish you every success for the future. And look forward to meeting some of you in various forums as the years go by. So thank you very much indeed.